Hello students, after having discussed complete comprehensive overview on endocrine system, by now we know that anterior pituitary produces 6 hormones. In this video, we will study functions of these hormones that are secreted by anterior pituitary, their analogues and their inhibitors. Now, analogues are the agents that possess functions similar to hormone, whereas inhibitors are the agents that inhibit or antagonize the actions of these hormones. Look at this figure. By now we know that hypothalamus is located towards the base of brain and pituitary gland is located just below the hypothalamus. Now look at this figure. This is the zoomed view of hypothalamus and the pituitary gland. Now pituitary gland has two lobes. This is anterior pituitary and this is posterior pituitary. Now, hypothalamus produces releasing hormones that are released in the network of capillaries called as pituitary portal system. Now, these releasing hormones regulate functioning of anterior pituitary. Now, 1, 2, 3, 4, 5, 6. These are the 6 hormones that are produced by the anterior pituitary, namely ACTH, that is adrenocorticotropic hormone, TSH, that is the thyroid stimulating hormone, then 2 gonadotropins, namely FSH, that is the follicle stimulating hormone, LH, that is luteinizing hormone. Another hormone produced by anterior pituitary is the GH, that is the growth hormone, and prolactin. Now, CRH, that is the corticotropin releasing hormone, stimulates release of adrenocorticotropic hormone from the anterior pituitary. Now, this adrenocorticotropic hormone ACTH further stimulates adrenal cortex to produce 3 types of hormones, namely glucocorticoids, mineralocorticoids, and androgens. Then thyroid releasing hormone, that is TRH, stimulates the release of thyroid stimulating hormone, that is TSH, and TSH further stimulates thyroid gland to produce T3, that is the triiodothyronine, and T4, that is thyroxine. Now, in addition to this, GnRH, that is the gonadotropin releasing hormone released by hypothalamus, stimulates the release of gonadotropins from anterior pituitary, that is FSH and LH. Now, FSH and LH they work in harmony and they together regulate the functioning of ovaries and testes. Now, these hormones are responsible for ovulation, then secretion of estrogen in women, whereas in the men, they are responsible for spermatogenesis, that is the process of production of sperms, and the release of testosterone from the interstitial cells of testes. Then GHRH, that is growth hormone releasing hormone, stimulates the release of growth hormone from the anterior pituitary. Growth hormone is responsible for the growth and development of entire body and specifically required for the growth of skeletal muscles and bones. On the contrary, GHRIH, that is growth hormone release inhibiting hormone, inhibits the release of growth hormone by the anterior pituitary. Then PRH, that is the prolactin releasing hormone, stimulates the release of prolactin from the anterior pituitary, and this prolactin stimulates the production of milk by the mammary glands. On the contrary, dopamine, also termed as PIH, that is prolactin inhibiting hormone, inhibits the release of prolactin. So, this diagram beautifully explains hormones that are released by the anterior pituitary and their control mediated by the hypothalamus. Now, let's study each of these hormones individually, their functions, analogues, inhibitors, and their uses or indications. The first hormone that we are going to discuss is a growth hormone, in short GH. Now, growth hormone that is produced naturally by our body is also called as somatotropin. Now, somatotropin induces growth and development of the entire body, but it's specifically very important for the growth of skeletal muscles and the bones. Now, look at this figure. Now, GHRH stimulates release of growth hormone Growth hormone is also called as somatotropin. Now, somatropin. Somatropin is an analog of somatotropin, or somatropin is an analog of growth hormone. Now here HGH stands for high purity recombinant growth hormone. Now somatropin is similar to growth hormone in structure and function. It is very high purity and it is synthesized by recombinant DNA technology. Now, deficiency of growth hormone in children causes pituitary dwarfism, while deficiency in the adults leads to low muscle and low bone mass. So, somatropin is useful in the management of pituitary dwarfism as well as in the management of growth hormone deficiency in adults. Now, somatropin is also indicated in the treatment of AIDS-related wasting. Somatropin increases lean body mass, increases body weight, and improves physical strength or stamina in the patients of AIDS. After discussing growth hormone and its analog somatropin, let's study growth hormone inhibitors. Now look at this figure. GHRIH is also called as somatostatin. Now it's produced naturally in the body and it primarily inhibits release of growth hormone by the anterior pituitary. Now in addition to growth hormone, somatostatin also inhibits other secretions of anterior pituitary, namely prolactin, thyroid stimulating hormone. It also inhibits secretion of pancreas, namely insulin and glucagon. In addition to this, somatostatin inhibits almost all GI secretions, like it inhibits secretion of gastric acid, gastrin, hydrochloric acid, bile, cholecystokinin. It also reduces fluid in the colon. Somatostatin also inhibits gastrointestinal motility. Now, in addition to this, somatostatin constricts blood vessels supplying blood to GIT and thus they reduce gastrointestinal blood flow. Now, octreotide and lanreotide are the synthetic analogues of somatostatin. Now, these agents also inhibit the secretion of growth hormone. Now, octreotide, analog of somatostatin, is useful in the treatment of acromegaly. Now, acromegaly is caused due to excess growth hormone in the adults. Now, as somatostatin inhibits almost all gastrointestinal secretion, octreotide is also useful in the treatment of secretory diarrheas associated with carcinoid, AIDS, etc. Now, carcinoid diarrhea is caused due to excessive secretion of serotonin. Octreotide is very useful here also. Now, as already discussed, somatostatin constrict gastrointestinal blood vessels and reduce gastrointestinal blood flow. Therefore, octreotide is also useful in the treatment of acute bleeding from esophageal varices, that is bleeding from the veins in the liver. Now, in addition to this, pegvisomant is a growth hormone receptor antagonist. Now, it blocks the growth receptors and thus it prevents or it blocks the action of growth hormone, and therefore it is very useful in the treatment of acromegaly, which is caused due to pituitary adenomas. Now, as we know, acromegaly in adults is caused because of the excessive secretion of growth hormone. Now, here excessive secretion of growth hormone is caused because of pituitary adenomas. Pituitary adenomas are the benign tumors of pituitary gland that produce excessive amount of growth hormones. So, pegvisomant is useful in the treatment of acromegaly due to pituitary adenomas. So, this is in brief on growth hormone. It's analog and also its inhibitors, namely octreotide and lanreotide. After growth hormone, let's talk about prolactin, another hormone secreted by anterior pituitary. Now look at this figure. Now PRH, that is the prolactin releasing hormone secreted by hypothalamus, stimulates anterior pituitary to secrete prolactin. Now let's quickly review functions of prolactin. Prolactin induces growth and development of breast during pregnancy. Prolactin is essential for lactation. That means it induces production of milk by the mammary glands or by the breast soon after the childbirth. Now another very important point, increased prolactin inhibits release of GnRH, that is inhibits release of gonadotropin releasing hormone from hypothalamus, which inhibits release of FSH and LH from the anterior pituitary. Now, reduced follicle stimulating hormone and reduced luteinizing hormone further causes amenorrhea, that is absence of monthly menstruation. It causes reduced ovulation and infertility in women. So, this is caused because of increased prolactin in the blood, that is hyperprolactinemia. Now, hyperprolactinemia in males can also cause infertility. Now let's discuss prolactin inhibiting hormone, that is PIH. PIH is also termed as dopamine. Dopamine inhibits secretion of prolactin. So look at this figure. PIH or dopamine released by the hypothalamus binds to dopamine D2 receptors on lactotrophs and inhibit secretion of prolactin. Now, as dopamine inhibits secretion of prolactin, dopamine agonists also inhibit the secretion of prolactin. So, drugs like bromocriptine, cabergoline are dopamine agonists, and these drugs inhibit secretion of prolactin and are useful in the treatment of hyperprolactinemia. Now, as increased prolactin causes hypogonadism and infertility, dopamine agonists restore gonadal function. Now, increased prolactin can also be caused because of prolactinomas. Now, prolactinomas are the benign tumors of pituitary gland that produce excessive prolactin. So, in addition to increased secretion of prolactin, these prolactinomas also compress optic chiasma and cause visual disturbances. So, bromocriptine and cabergoline also inhibits secretion of prolactin from these prolactinomas. They regress prolactinomas and they also improve visual disturbances. So, this is in brief on prolactin. Then prolactin inhibitors, that is dopamine agonist, namely bromocriptine and cabergoline. After growth hormone and prolactin, let's discuss gonadotropins. Now, as the name suggests, these hormones regulate functioning of gonads, namely ovaries in females and testes in the males. Now, follicle stimulating hormone, in short FSH, and luteinizing hormone, in short LH, are the two gonadotropins which are secreted by anterior pituitary. Now, FSH and LH work in harmony with each other. Now, let's first discuss functions of FSH and LH in the females. Now, as the name suggests, follicle stimulating hormone, it regulates growth and maturation of ovarian follicles. Ovarian follicles are present in the ovaries. Now, developing follicles secrete estrogen. Now, luteinizing hormone in association with FSH causes rupture of mature follicles, and that causes release of ovum, or the egg is released, and the process is called as ovulation. Now, the ruptured follicle is called as corpus luteum and it produces predominantly progesterone. Now, as in the females, in males, follicle stimulating hormone induces spermatogenesis, that is, it's responsible for the production of sperms, while luteinizing hormone induces release of testosterone by the interstitial cells of testes. Thus, FSH and LH are required for the development and release of egg from the ovaries, then production of sperms, and secretion of reproductive hormones, namely estrogen, progesterone, and testosterone. Now, reduced production of FSH and LH causes infertility. Now, let's see to the preparations of FSH and LH, which are mainly used in the treatment of infertility. Now, preparations include menotropins. It is a preparation that consists of FSH and LH. Now, very important to remember and to understand that urine of menopausal women is found to be a very good source of FSH and LH. So, menotropins is a preparation that is prepared from the urine of menopausal women. And thus, source of menotropins is the urinary human menopausal gonadotropin. Then urofolitropin, it is a pure FSH preparation. Its source is also urinary human menopausal gonadotropin. Now, in addition to these urinary gonadotropin preparation, recombinant preparations are also developed. These are developed by using the recombinant DNA technology. Now, these products can be synthesized in large volume and with high purity. Now, folitropin alpha and folitropin beta, these are recombinant FSH preparations, while lutropin is a recombinant LH preparation. Now, these preparations are used in the treatment of infertility. In women, these preparations are used to induce ovulation, while in males, these are used for the production of sperms, that is for the spermatogenesis. Now, these preparations are also used to aid in the in vitro fertilization. So, this is about gonadotropins, namely FSH, LH and their preparations and indications. Another hormone released by the anterior pituitary is the adrenocorticotropic hormone, in short ACTH. Now, look at this figure. ACTH stimulates adrenal cortex to secrete three hormones, namely glucocorticoids, mineralocorticoids and androgens. Now, cortisol is the main glucocorticoid hormone. Now, glucocorticoids, as the name suggests, primarily regulate metabolism of glucose. Now, glucocorticoids increase blood glucose levels and prepare the body to fight with the stress, because during stress, glucose requirement of the body increases. Now, aldosterone is the main mineralocorticoid. Now, aldosterone regulates water and electrolyte balance of the body. Then androgens, specifically dihydroepiandrosterone, in short DHEA, is produced in a very small quantity by the adrenal cortex. Now, this DHEA is a precursor and it gets converted to testosterone and estradiol. Now, main function of androgens here is to control libido and sex drive. So, after functions of these hormones, let's talk about the use of ACTH. Now, ACTH can be used for the diagnostic purpose. It can be used for the diagnosis or for the identification of disorders of pituitary adrenal axis. That is to find out that if the pituitary is functioning normally, if the hypothalamus is functioning normally. Now, as we know, ACTH stimulates adrenal cortex to release cortisol. If ACTH injection is injected intravenously, increase in the level of plasma cortisol indicates normal functioning of adrenal cortex. But on the contrary, if ACTH injected intravenously does not increase levels of plasma cortisol, it indicates the presence of non-functional adrenal cortex. Now, as adrenal cortex is destroyed in the Addison's disease, ACTH test can be used as a diagnostic tool for the detection of Addison's disease. So, this is about ACTH, the hormones that are produced by the stimulation of ACTH and the diagnostic use of the ACTH. So, after ACTH, let's talk about the next hormone, that is released by the anterior pituitary, that is the thyroid stimulating hormone, in short TSH. Now let's talk about the thyroid stimulating hormone. Thyroid stimulating hormone, in short TSH, is also released from anterior pituitary. So TSH released from the anterior pituitary stimulate the thyroid gland to produce thyroxine, that is T4, and triiodothyronine, that is T3. Now let's understand the use of TSH. Now TSH is used for the is used as a diagnostic test. Now TSH test is a first line screening test for the identification of hypothyroidism or hyperthyroidism. Now very important to understand here that hypothyroidism is characterized by low levels of T3 and T4, while hyperthyroidism is characterized by the high levels of T3 and T4. Now let's see to the normal TSH range. Now normal TSH ranges from 0.4 to 4.5 milliunits per liter. Now during hypothyroidism, T3 and T4 levels fall. So reduced T3 and T4 stimulate increased secretion of TSH. So elevated TSH levels indicate primary hypothyroidism. Similarly, reduced or low TSH levels indicate primary hyperthyroidism. So this is in brief a summary on anterior pituitary hormones, their analogues and inhibitors. Please note this video is meant only for academic purpose. For use of any of these drugs, that is for the clinical use, kindly consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.